Back to school, experts agree that kids need to go back to classrooms for their mental health. But what about their risk for COVID-19 as they join together with other kids as well as adults? Channel 2 health reporter Haley Hernandez is getting some answers.
We know one of the biggest mysteries during this COVID pandemic is that kids don't seem to be getting it as much as adults. As more time goes on, we're learning why.
Children account for 22% of our U.S. population, but only account for about 1.7% of COVID cases. And this is very odd for an endemic or an epidemic. Usually kids and elders are hit the hardest.
Dr. Caitlin Jetelina from the University of Texas School of Public Health says first it has something to do with ACE2 inhibitors.
These are basically open doors on cells for COVID to enter, and kids actually have less of these.
Another factor, transmission rates.
We know from a Chicago study, a very small study, that the transmission rates seem to be low from kid to kid and kid to adult.
And kids with COVID might not be showing symptoms, so they're not getting tested. Then if they are tested, the results might be missed.
They have very small nasal pathways, and that impacts the accuracy of a COVID test, and COVID can then also still go undetected.
When we think about kids in the classroom and this virus spreading to others, there's still a lot of questions.
It seems that it's much less likely for a kid to transmit the disease to an adult. However, what we do know is that once a kid has the virus, their viral load is as high as an adult is. So the potential for spread can still be there.
Kids' social circles could also be a factor. In many cases, they're not getting out as much as adults, like to grocery stores or bars. Should kids with pre-existing conditions be in the classroom, though? We have more on that on click2houston.com. I'm health reporter Haley Hernandez, KPRC, Channel 2 News.